welcome to Look to the Children Show. It's February 2022, which is crazy to even say um, that it's already February of 2022. But my name is Dr. Eric Kowalki, and this is the Look to the Children Show with ChiroSecure. Thanks to Dr. Stu Hoffman and all that ChiroSecure does for this amazing profession to put on shows like this and everything else that they do. If you haven't followed them or this is your first time hearing something like this for ChiroSecure, make sure you get on their Facebook page and their social media and follow them. They put out so much great content for chiropractors, especially in this crazy environment and world where rules and information is changing so quick. It's really nice to be up to date and have just a leg up on what's happening and what's coming to be prepared as chiropractors. So comment below if you have any questions or any feedback. This show is specific to kids in chiropractic. I have a practice in Grand Rapids, Michigan. We see hundreds and hundreds of kids every single week. And families and lifetime family wellness practice. The first family that ever signed up in our office 10 years ago, almost 11 years ago, is still under care in our office today. And we're just passionate about serving families and serving kids and principal chiropractic care and allowing the full expression of their selves and allowing their nervous systems to function at a high level. So now we have 5 doctors, 16 adjusting tables, 8 adjusting rooms, 5 exam rooms. We have a team of like 16 people. So we serve in a big way in our clinic. And this show is for us to share a little bit about what we're doing and how to impact more kids in your practice. Take back today after lunch or tomorrow or next week and implement stuff right away. We also started Sked, a software program that helps us just scale our clinic and provide a better experience for our patients. So something we're going to talk about today. 3 C's we're going to give you: convenience, care plans, and converting is what we're going to talk about. And if you see kids in your office and you've been in practice for any number of years, you know it's just different. And we like to keep things simple as chiropractors. And with all the practice management companies out there and what we're taught, we like to do care plans. We like to have as specific types of care plans as we can to make it not super complicated for us to figure out and for our teams to figure out. So we might have 5 to 10, care plans that are probably the most common. There's always exceptions to the rule. But what we found with infants and kids is exceptions are almost more common than just the regular standard version. You don't never know what's coming at you. You may have a mom coming in with, her infant with earaches and colic, and she gets it. Like, she understands chiropractic after you go through your day 1 education or day 1 and day 2 education. We do a group report of findings or new patient orientation, we call it. So there's moms that come to that they're all in, they totally get it, but their immediate concern is so strong that they don't even want to think about short-term goals or long-term goals. They're like, okay, I know I want my kid to be healthy forever. That's the long-term goal. Short-term goal, I don't want these ear infections ever to come back. An immediate goal is I want them gone as soon as possible so that we can move on with our life, because it's affecting every area of our life. So if you present them a long-term care plan, 12 months or something, they might not even be able to wrap their heads around that at this point. They're like, well, I just need to know, is this even going to work for my kid? And by work, they mean if it doesn't help his ear infections, I gotta go through a bunch of other stuff in order to move forward, and I need to go through a lot of other things to get the ear infections better, and I don't know if I can commit to that. So you need to think as a chiropractor, it's not so much they don't believe in what we're doing or they don't trust what we're doing, and if they don't sign a 12-month, they're not committing. To more to, they just don't know what's coming in their life in the next couple months, and if this doesn't work, they got to do something else, and they're not going to be able to have the time or the resources potentially to do both, even if they understand it. So you have to meet those parents where they're at, and so what we do in our office is a 10-pack, we call it. We do 10 visits all at once, but I don't even necessarily know 3 weeks from now what frequency I'm going to see that child. It all depends on their subluxation pattern and if they're holding or not. So I might see them really frequently for a week or 2, and then reassess and see, okay, where are we at? How are we doing? How is their spine holding? How is their nervous system adapting you want to do another evaluation or exam on that little child? And so just know, you got to sometimes take it slow to go long, to go far with that mom, and just meet them where they're at along that process. And it's okay to do that in that scenario. It's totally different than the guy coming in with low back pain that wants to just like try you out, and you're the 10th chiropractor that he's tried out. And if it doesn't work in 2 visits, he's not going to come back. Totally different scenario, even though it's kind of presenting the same care plan wise. Um, who it's coming from and the place that it's coming from is totally different. So just divide that in your mind, and get clarity on that, on what decisions you're making as far as care planning. Um, and you talk about converting. I have a lot of doctors talk to me about trying to convert moms and dads and parents under care as well. And this is a very delicate situation, because sometimes, well, most of the time, the mom also has tons of issues. So as you're going through the day one education, you'll often see the mom or have the mom say something like, "Oh man, maybe I could use this too," or like, "Oh, she'll start asking questions about herself potentially, or about the husband." But you gotta. Some parents, they're all in. They're like, "Yeah, I'll totally do this too." I think it depends on how severe the situation is with their child. If it's very, very severe, they don't care about themselves at all. If it's like mildly disruptive to their life, but not severe in terms of like affecting every day or the potential outcome of their child health wise, or they don't see it like that, then they're more open to like themselves and getting themselves evaluated and checked. But if you mix that up and you don't read that right, and the parent is very concerned about their child and the overall well-being and the health of their child, and there's a very serious situation going on, and you start talking about the mom or the dad, you're going to totally blow it, and you're going to miss the opportunity to serve that child, which is your main goal. So don't over sell on the first visit. It's going to come. You know what you do. What you do is remove nerve interference, and you're the best at it, and you're the only one that can do it. You're not in charge of getting the ear infections to go away, or the colic, or whatever that is. You're not treating that condition. You're removing vertebral subluxations. You're improving the nervous system function. In turn, when you do that, the body's going to function and heal better. Are the ear infections going to go away? I have no idea, but I know the nerve interference is going to improve, and I'm going to improve the function of the brain, its ability to communicate to the body, and the body back to the brain. And in turn, what happens most of the time is the ear infections go away and get better. But don't commit to what you can't control. So you can't control symptoms. You can control what you're really the best at, and that's removing nerve interference. So communicating that really clearly on the front end is probably the biggest key to converting. And converting being, you need to get the infant adjusted. I think that's like base one. The home run is the lifetime family wellness. The whole family's under care forever. But sometimes, it's a grand slam on the first visit and the whole family signs up. And that happens very frequently. And sometimes it's very slow and you're just moving around the bases. So I think one of the big mistakes that we make, or maybe we just don't focus on it enough, is we pour all of our education and all of our resources into converting on the first 2 days. So if we can get them to hit a grand slam and the whole family gets it and they're under lifetime family wellness care, awesome. But if they don't, and you just go to base one, let's say, and you just get a few visits committed to for this child, then there needs to be the same amount of effort and education to get from base one to base two, and base two to base three, base three to base home run. And so sometimes we just don't have the system set up in the adjusting room flow and process to do that really effectively. So I want you to think about that. You go through so much effort on the first 2 visits, but it might be visit 10 when the symptoms are starting to improve, and now the mom or the dad is open to even thinking about getting evaluated themselves. So you have to really remember that, record that in your EHR, whatever system you need. You need a system and a process to follow back up and continue the conversion process around the other people in the family and getting them started. And you just might need to wait 10 visits to ask for that. Um, and then they got to go back kind of through that process. So it's just a totally different system, and it does take more work and more effort and more intention to do that. And I think what happens most of the time is we just forget about it. We get 10 visits in, the child is doing better. We maybe sign another care plan, a longer term. We move into the short term goal of like these ear infections don't want to come back. And then we move into a long term goal, and we just never get the parents assessed or evaluated. And it's not that they didn't want to; it's that their life's busy too. And if we're not thinking about it and bringing it up and talking about it, they're not either, because they just moved on. Their immediate need and urgency was fixed through the process. So just remember that, record that, follow back up, even if it doesn't happen initially. It's not necessarily like they didn't convert. It's just it needs to go through a different system and a different process than you would typically go through. So that's converting and care planning around infants and kids that I think might help you guys a little bit. The third one, which I think you really need to focus on in 2022, is convenience. This is big time, high level. If you could do one thing this year that's going to improve your internal referrals, that's going to drive more engagement with your social media, drive more people in your community talking about your business and your mission and what it is that you do. And I'm speaking from experience. We're literally doing all of these things. Convenience is something we focused on for multiple years now. We get 60 plus internal referrals every single month because we just focus on, I shouldn't say just, we focus on experience and convenience, and making the whole process great for every person that walks through our door. And convenience is probably the biggest one. And what do I mean by convenience? I mean, think about what it takes for one of your patients to come into your office for an appointment. They have to remember the appointment. They have to make sure it works with their calendar, their schedule. We have 6 kids, and they had dance this weekend, 3 basketball games, 4 hockey games, a tournament. We didn't get home till 11 o'clock last night. They won in a shootout. It was epic. So now they play tomorrow again, or they play today, which it's just crazy. So in the middle of the week, we have a tournament to go to, a half an hour away. I didn't know that was going to happen last week, let alone 3 months ago when I built out my schedule for chiropractic visits. So parents are constantly changing their schedules, trying to make things work. Inherently, hopefully, you did your job on the education. They get it. They want to come into your office. The reason they're not most of the time, and the reason they're missing their appointments, is because you don't make it convenient for them to change their appointment to a time that works with them. They have to call you, and you're only open 20 some hours a week. So they have to find a time that you're open to call you to tell you that they need to move their appointment. And it's just not convenient. Nobody wants to call anymore. I had a dentist appointment last week, and the lady, every chiropractor, every time you go somewhere and they say, "What do you do?" and you say chiropractor, they start going off on all these stories. So she tells me, "Well, I canceled my chiropractic appointment today, and I didn't make any new ones because I don't like calling, and I don't know my schedule next week. And in fact, I might just not go in for a while and see if I'm doing okay." Uh, and I was like, "Oh my gosh, that's so funny because this is something that we focus on a lot." The appointment's not synced with her normal calendar. She can't see the current availability today. So if there was a way for her to see the availability today, so she had an appointment at 2 o'clock, she told me. So she could have made it earlier in the day, but she would have had to call and find out if there's an availability and schedule that. It was too much of a hassle for her to do, so she just canceled altogether. But if there was an app where she could see the availability today, she could see what's busy and what's not busy, that there's an opening at 10 or 9:15, and she can move the appointment from 2 to 9:15 and then show up to that appointment. And there's a text message that reminds her, that links her to that app to show her the availability, that also links those appointments with her Google Calendar and her Apple iCal calendar and her Outlook calendar, so she can see how that works with her meeting, so she never misses an appointment. That would be amazing, and that would be way more convenient for her than forcing her to call the office for that. And so that's what we created with Sked. So if you're not using a software system that allows the patients to schedule, reschedule, see their appointments, see their kids' appointments, sync those appointments to their normal work calendar and their life calendar and family calendar, I mean, you're missing the boat this year. You're stuck in an old way that is just costing you people. It's costing you retention. It's costing you referrals. I can't tell you how many people would come into our office and like, "Yeah, my friend Mary said, she just loves coming here because you guys make it convenient for her life. She can swing in, get adjusted. She can make sure the wait times aren't that long. I mean, it's just so convenient for her that it makes it part of her life, and she can stick to this long term. And that's how we've been able to retain so many people for 10 plus years. Is we make it easy for them to make chiropractic part of their life. In today's day and age, it's not so much that they can't afford it. It's not so much that they don't really have the time to do it. It's that they can't fit it into the routine of their life. So your job is to not only share the value and convert, and they get lifetime family wellness care, but usually we stop there. We just expect them to show up and haul their 6 kids all the way across town every single week forever. And it's just not happening. It's just not going to happen. We live 25 minutes from my office, and I'm not going to drive 25 minutes every single week. I can't even get all 6 kids in the same place at the same time in my own house, let alone hauling them all the way over to the office. And I value chiropractic care. I'm the chiropractor. So you got to make it convenient. You got to allow the parents to see the schedules, and it all does that through the Sked app that we created, sked.life. So if you haven't seen it or heard about it, please check it out. It's going to be a game changer for your clinic. Or if your EHR does something, I mean, you got to use a system that makes it convenient for people in your office. Help them schedule their appointments. Have somebody on your team. We have Rachel on our team. She's the lead experience coordinator, is her role. Her job is to make everybody's experience in the office awesome. We hired her, and she's trained to just make everybody's experience awesome, make sure that they have their appointments scheduled, make sure that they work when they leave, their next appointment works. If they're having a bad day, she gives them a bad day mug. She does everything to make their experience great. So making their experience great and making it convenient is probably the 2 biggest levers that you could pull in 2022 to make a difference and grow your practice. We grew like 35% last year in visits and collections, and I can tell you that was it, making it convenient and experience. So hopefully I beat that to a lot, so you really get it for that one. But I hope you love seeing kids. I hope you got something out of this you could take back to your practice, implement right away. Kids are the future of our world, and chiropractic care is essential to raising healthy, happy children. And in today's environment, they need less nerve interference. They need you. They need chiropractors to be bold and to be educating and communicating and adjusting specific subluxations and improving their health, because this is the next generation that's going to just take over everything, and we need them to be healthy and not sick adults. So go serve the masses. Thanks so much. We'll see you guys in March.
Today's pediatric show, Look to the Children, was brought to you by ChiroSecure.